Hey everyone, if you're on Medicare right now, you absolutely need to pay attention to this. Something major is happening with Medicare coverage, and a lot of people are finding out the hard way when they go to the pharmacy or their doctor's office. I'm talking unexpected bills, denied claims, and coverage changes that nobody warned you about properly. Maybe you went to pick up your prescription and suddenly it's not covered anymore. Or maybe you got a bill in the mail for a doctor's visit that used to be free. You're sitting there thinking, did I do something wrong? Did I miss a payment? Is this a mistake? So today, I'm breaking down exactly what's changing with Medicare, who's affected, and most importantly, what you need to do to protect yourself. I've gone through all the official Medicare updates, the CMS announcements, and the policy changes so you don't have to wade through hundreds of pages of confusing government documents. I've got the facts, I've got the details, and I'm going to explain this in a way that actually makes sense. Let's dive in. Here's what we're covering today, and trust me, you're going to want to stick around for all of it. First, I'm going to explain what's changing with Medicare coverage and why it's happening now. Then we'll talk about who's affected, because these changes aren't hitting everyone the same way. Some people are seeing major impacts while others might not notice much at all. We'll go through the specific changes to Medicare Part A, Part B, Part D, and Medicare Advantage plans. And finally, I'll give you a clear action plan, what you need to check today, who you might need to contact, and how to make sure you're not paying more than you should. Because at the end of the day, this is your healthcare we're talking about, and you deserve to know what's going on. Sound good? Let's get into it. Okay, so first question, who's actually affected by these Medicare changes? Well, the short answer is a lot of people, but let me break down the specific groups that need to pay extra attention. Original Medicare beneficiaries. If you're on Medicare Part A and Part B, the traditional Medicare, you're going to see some changes to premiums, deductibles, and coverage rules. Some preventive services that used to be completely free now have different billing codes, and that's causing confusion. Medicare Part D enrollees. If you have prescription drug coverage through Medicare Part D, there are new rules about which medications are covered and how much you'll pay out of pocket. Some drugs got moved to different tiers, which means your copay might be different than it was last year. Medicare Advantage plan members. This is a big one. If you're on a Medicare Advantage plan, also called Part C, your plan might have changed its network, its formulary, or its coverage rules. Some plans dropped doctors or hospitals from their network, and people are finding out when they try to make an appointment. People with chronic conditions. If you're managing diabetes, heart disease, COPD, or any ongoing health issue, these changes could impact your medication costs and access to specialists. And here's who else needs to pay attention: seniors living on fixed incomes, people who just turned 65 and are new to Medicare, folks who are still working but also on Medicare, and anyone who's been putting off dealing with their Medicare paperwork. I know a lot of you have reached out saying you're confused, you're frustrated, and you feel like nobody's explaining this in plain English. That's exactly why I'm making this video. So what exactly is changing? Let me break it down piece by piece. Medicare Part B premiums and deductibles. The standard monthly premium for Medicare Part B went up. For most people, it's being deducted automatically from their Social Security check, so you might have noticed your Social Security payment was a little smaller this month. The annual deductible also increased, which means you'll pay more out of pocket before Medicare starts covering things. Prescription drug coverage changes. Medicare Part D plans had to update their formularies, that's the list of covered drugs. Some medications got dropped entirely, others moved to higher cost tiers. If you've been taking the same medication for years, you might suddenly find it costs way more, or your plan wants you to try a different drug first. That's called step therapy, and it's frustrating. Medicare Advantage network changes. A lot of Medicare Advantage plans renegotiated their contracts with doctors and hospitals. That means some providers who were in network last year aren't in network anymore. If you don't check, you could end up with a massive bill because you went to an out-of-network doctor without realizing it. New coverage rules for certain services. Some diagnostic tests, therapy services, and medical equipment now have different coverage criteria. What used to be automatically approved might now require prior authorization, which means more paperwork and more waiting. Income-related monthly adjustment amounts, IRMAA. If you have higher income, you pay more for Medicare. The income brackets for IRMAA change, so if you had a good year financially 2 years ago, you might be paying higher premiums now based on that old tax return. Here's a direct quote from the CMS policy update. Beneficiaries should review their coverage annually during open enrollment to ensure their plan meets their current healthcare needs and financial situation. Translation: they're basically saying it's your job to keep track of all this. They made the changes, but you've got to figure out how it affects you. And I know that's not fair, but that's the reality we're dealing with. If you didn't review your plan during the last open enrollment period, you might be stuck with these changes until the next enrollment window. That's why this stuff matters so much. Before we get into how to handle all this, I want to take a quick moment to talk about something important. You know, when you're dealing with Medicare and healthcare changes, it can feel really overwhelming. You're not just dealing with confusing paperwork, you're dealing with your health, your financial security, and your peace of mind. And the truth is, the system doesn't make it easy. But here's what I want you to know: you're not alone in this. Millions of people are trying to navigate the exact same Medicare maze. They're getting the same confusing notices, dealing with the same surprise bills, and asking the same questions you are. That's exactly why I created this channel. I've been through this stuff myself, with my own family, and I know how hard it is to find clear, honest information that actually helps. If this video is making things clearer for you, do me a huge favor. Hit that subscribe button and turn on the notification bell. Every time there's a major update to Medicare, Medicaid, or any benefits program, I'm here breaking it down in a way that real people can actually understand. No jargon, no confusion, just the facts you need. All right, let's talk about what you can actually do about all this. Okay, so here's your action plan. This is what you need to do right now to protect yourself and make sure you're not overpaying or missing out on coverage you're entitled to. Step 1. Check your Medicare summary notice. This is the statement you get from Medicare showing what services you received and what Medicare paid. You should be getting these every 3 months. Look at it carefully. Make sure the services listed are things you actually received. If something looks wrong, that's your first red flag. Step 2. Review your prescription drug coverage. Go to Medicare.gov and use their Plan Finder tool. Enter all your medications and see if your current Part D plan is still the best option. You might find another plan that covers your drugs for less money. This could save you hundreds of dollars a year. Step 3. Confirm your doctors are still in network. If you have a Medicare Advantage plan, call your doctor's office and ask if they're still accepting your plan. Don't assume. Things change, and you don't want to find out the hard way when you show up for an appointment. Step 4. Understand your true costs. Add up your monthly premiums, your deductibles, your copays, and your prescription costs. Get the full picture of what you're actually spending on healthcare. Sometimes a plan with a higher premium actually saves you money overall if it has better drug coverage or lower copays. Step 5. Know your rights. If a claim gets denied, you can appeal. If your drug isn't covered, you can request an exception. If you can't afford your premiums, there are programs that can help. You have options, but you have to know they exist and you have to use them. Step 6. Get help if you need it. Every state has a SHIP program, that's the State Health Insurance Assistance Program. These are free counselors who can help you understand your Medicare options. They don't work for insurance companies, they work for you. Look up your local SHIP office and give them a call. Step 7. Mark your calendar for the next open enrollment. Medicare open enrollment runs from October 15th to December 7th every year. That's your chance to change plans if your current one isn't working for you. Don't miss that window. Set a reminder on your phone right now. Look, I know Medicare is complicated. It feels like they designed the system to be as confusing as possible. You've got Part A, Part B, Part C, Part D, Medigap, Medicare Advantage, and a million different rules that all seem to contradict each other. And just when you think you've figured it out, they change something. It's exhausting. I get it, but here's what I want you to remember. You paid into this system. You worked your whole life, you paid your Medicare taxes, and you earned these benefits. You deserve to get the healthcare coverage you're entitled to without jumping through a million hoops or paying more than you should. If something changed and it's costing you more money, don't just accept it. Ask questions. Call Medicare. Talk to your plan. Get a SHIP counselor involved. Sometimes there's a simple fix, like switching to a different plan or getting an exception approved. You won't know unless you ask. And if you're feeling overwhelmed, that's completely normal. This stuff is overwhelming, but you don't have to figure it all out in one day. Take it step by step. Start with one thing on that action plan I just gave you. Just one. Check your Medicare summary notice, or look up your SHIP office, or review your prescription coverage. Just do one thing today. Then do another thing tomorrow. That's how you get through this. One step at a time. And remember, there are people who can help you. You don't have to do this alone. Your family, your friends, your local senior center, your SHIP counselor, even your doctor's office can point you in the right direction. Don't be afraid to ask for help. That's not a weakness, that's being smart. If this video helped you understand what's going on with Medicare right now, please hit that like button and subscribe to the channel. It really does help more people find this information when they're searching for answers. I'm here every single week breaking down exactly this kind of stuff. Medicare, Medicaid, Social Security, veterans benefits, all the programs that real people depend on. And if you've got questions, drop them in the comments below.